This week, CMS published details for the looming Medicaid work requirement, and Minnesota has a new map of non-pharmaceutical pain care providers. Welcome to the June 5th edition of Healthline, the weekly news podcast from the Minnesota Hospital Association. I'm Tim Nelson.
And I'm Abby Mocktig.
The big news this week, the Centers for Medicare and Medicaid Services released their proposed community engagement rules set to go into effect next year. That's CMS shorthand for work, school, and volunteer requirements for beneficiaries of Medicaid, known as medical assistants in Minnesota. CMS Administrator Mehmet Oz spoke frankly about the rules' purpose at a White House press briefing this week.
We're put here to make a difference. But if you're sitting at home, which is true for the millions of people who are able-bodied on Medicaid, on average, you're spending 6.1 hours watching television or just hanging around. That's not why you're here. So as a path to prosperity, Congress very wisely said, let's get you back into the workforce.
The rules flesh out the One Big Beautiful Bill Act passed by Congress last summer. They include exemptions for people considered medically frail, but some observers were alarmed by the specifications for the exemptions. Siggy Reese covers CMS for Inside Health Policy in Washington and wrote about the new rule this week, noting that enrollees seeking an exemption will have to document not just their medical conditions, but their ability to work or not work.
Folks across the board, when it comes to patient advocates for people with various different conditions, are very concerned that tying medical frailty to ability to work is going to cause enrollment to drop because folks are not going to be able to complete that paperwork.
Providers are concerned that those beneficiaries will lose Medicaid coverage, turn to hospital emergency departments, and accelerate the rise of uncompensated care. State officials previously said they expected about 140,000 Minnesotans to lose medical assistance. Reporter Amy Lotvin is also with Inside Health Policy, an online health policy news outlet. She said the new standard is still going through the rulemaking process.
There's no definitive response yet, but the folks that we've talked to have definitely said that they are going to be asking for more time.
As of now, the rule is scheduled to go into effect January 1st.
Also this week, the influential conservative policy think tank, the Paragon Health Institute, released a new report alleging 6 million Americans were improperly enrolled in Affordable Care Act plans that included taxpayer subsidies. In Minnesota, that could be no small number. On a per capita basis, that's about 103,000 people, more than half the number of people expected to lose Medicaid coverage in coming years, and about 5 times the number of people that dropped out of MNsure this year when Congress let COVID-era subsidies expire. Paragon Health, for the record, did not look at Minnesota's ACA exchange or other states that do not have federally operated health insurance exchanges. But the report may have significant consequences. The Hill noted this week that Paragon and its executive director, former Trump economic advisor Brian Blais, have played a key role in recent federal health policy. They helped design the Medicaid cuts in the One Big Beautiful Bill last year. Blais recently told KFF that the fraud cost the federal government billions.
We at Paragon estimate that the amount of fraud just last year in the exchanges because of these enhanced subsidies is exceeding $20 billion a year.
The Paragon Institute also issued a report last year sharply critical of state-directed payment Medicaid programs that prompted Congress to move against the matching funds. That's now threatening to derail Minnesota's directed payment program, approved by the legislature last year, and intended to boost Medicaid reimbursements to the state by as much as $1 billion a year.
In other news this week, Minnesota closed its Medicaid provider revalidation period put in place after CMS demanded the state step up efforts to fight fraud. Fox 9 reported less than half of the state's previous 5,500 so-called high-risk providers had been revalidated, and that nearly 1,000 hadn't even tried to revalidate, even though they'd previously been submitting claims for reimbursement. Thousands more are still in the screening process or need additional review, according to KSTP-TV. But both WCCO-TV and the Rochester Post-Bulletin reported small providers said they had complied with the revalidation process, but were disenrolled this week and had their billing status terminated. Providers said everything from Meals on Wheels to housing services had lost funding. Also this week, the Star Tribune reported that UCare CEO Hillary Martin-Resnick got paid more than $1.2 million last year, including a $100,000 bonus as the nonprofit health insurer collapsed and left hospitals and other providers with millions in unpaid bills. Martin-Resnick and about 250 other people lost their jobs when UCare liquidated in December. UCare's former board chair told the Strib that Martin-Resnick had stayed through the wind down, that she'd not earned a bonus for financial benchmarks, and had been awarded only half her eligible bonus. And on a final note, the state and Hennepin Healthcare this week rolled out a first-in-the-nation pain treatment finder aimed at expanding access to pain treatments without drugs. The map offers information on 17,000 providers that offer treatments, including physical therapy, psychotherapy, chiropractic care, acupuncture, yoga, massage therapy, and other evidence-based treatments. It's aimed at curbing drug dependence and overdoses. CDC data shows nearly 1 in 4 U.S. adults reported chronic pain in 2023, and more than a third of those people had pain that limited activities at work or home. You can find the directory and be included in the listings at nopainmn.org. And that's it this week for Healthline, a weekly news podcast from the Minnesota Hospital Association. I'm Tim Nelson.
And I'm Abby Mocktig. Thanks for listening.